Afternoon, everyone. We'll just give it another minute, 30 seconds to let folks join, and then we'll get started. Right. Well, as folks are still joining, we will get started so that we can end on time. I just want to thank everyone for joining us today for part one of a two-part webinar series called Youth and Young Adults with Serious Mental Health Conditions, Reflections on 30 Years. Next slide, please. So I'm just going to go over some quick housekeeping items. This webinar is being recorded and will be made available on our website. If needed, ASL interpreters are available. Live captions are being auto-generated by Zoom. The icon to enable them is located at the bottom of your Zoom control panel. Please note that because this is a webinar, participants are automatically muted with webcams off. There will be a moderated Q&A session after the presentation, and you can use the Q&A button or the chat to send questions. Sorry. Please use the Q&A button or chat to send questions to the presenters. And if you have any technical problems, you can send a DM to me or an email at deirdre.logan@umassmed.edu. Next slide, please. And I just want to acknowledge our funders. So the Transitions to Adulthood Center for Research is a research center within the Implementation Science and Practice Advances Research Center, iSpark. And this webinar is funded by both NIDLR and SAMHSA on a variety of grants. And the authors, presenters would like to disclose that they have no conflicts of interest in this presentation or the future one. And with that, I'm going to turn it over to Marianne Davis. Thank you.
Thanks, Dee, and good afternoon, everybody. We're so excited that you're here. I'm Marianne Davis. I'm the former director of the Transitions to Adulthood Center for Research. I'm former because I recently retired, and that was part of the impetus for this two-part webinar series. After I retired, Nancy Korloff and I were talking and realized that many of the folks who were instrumental in sort of launching this field and sustaining it over time had retired. And we were concerned that we were at risk of losing sort of the stories of the initiation and development of the field. And so we started thinking about a webinar series that might capture some of that. This picture that you see is from about 10 years ago. Looking at it from the upper right is standing is Diane Sondheimer. I'm below her. Then to the left is Gwen White, and behind Gwen is Nancy Korloff. And all four of us are now retired. But in 1995, Nancy Korloff was already doing research in youth and young adults with serious mental health conditions, and I was just starting in 1995. Diane was the deputy chief of the Child, Adolescent, and Family branch in the Center for Mental Health Services within, bless you, Gwen, within the Substance Abuse and Mental Health Services Administration. And in 1998, she really started to advocate and look for opportunities to develop grant programs that SAMHSA could provide to improve services for youth, primarily in the children's system who are transitioning into adulthood. And then in 2002, Gwen White was one of the first recipients of the first set of grants that Diane was able to strategize and get offered. And each of the four of us have made pretty substantial contributions over time to the field. And while Bree Maselli and Amanda Basco were a little young in 1995 to start making substantial contributions. They really did so shortly thereafter. They have been really on the forefront of infusing both mental health services and research with youth voice for quite a while, such to the effect that they are no longer youths, but they can reflect on a substantial part of that history. Um, so with this webinar series, we hope to acknowledge and describe the initiation and the progress that we've seen in this field. And in so doing, identify some important themes that we think and believe are enduring themes that are valuable for folks to sort of note. Um, and I want to say that what we're sharing is not a formal review of a field. There are all kinds of methods for doing that formally, but rather we're sharing the stories of the field from our perspectives. Um, and finally, I just want to say that this webinar series was conceived of well over a year ago, which was well before the current administration had made or maybe even considered making the changes, the vast changes that we've seen to the federal government, in particular to SAMHSA and to research funders. But we feel like in some ways it's an opportunity that we have at this point to sort of look back on and acknowledge the progress that has been made and to really encourage those who are going to take it forward. And we're hoping that all of you will have the hope and the passion to do so in the coming years because there's nothing more valuable than improving services and supports and the experiences of youth and young adults with lived and living experience. So part one of the series is on policies and services. Part two is on research. And our part one starts today. I'm going to turn it over to Gwen and Bree for a very exciting next hour and a half or so.
Yeah. Thank you very much, Marianne. I'm Gwen White, and I'm sitting in Pittsburgh, where I directed 3 System of Care SAMHSA grants beginning in 1998. One of these, as Marianne has indicated, was the Partnership for Youth Transition Grant, where I came fascinated with work for this age group. It's also when I met Marianne Davis, Nancy Korloff, and Diane Sonheimer, and learned from their expertise in research and evaluation and change through funding. In 2010, I was privileged to be hired by Georgetown University to provide the technical assistance to the 2009 Healthy Transition grants. I worked then providing TA to states, tribes, and territories for the other grants listed here through 2020, working also for the Center for Applied Research Solutions and the University of Maryland. I met Bree in 2010 as part of my consulting with the Maine HTI grant.
Thank you, Gwen. And so I'm Bree Maselli. I'm coming to you from Maine. And as Gwen mentioned, I started in 2005 doing systems of care, youth engagement, and youth coordinator work. So I was hired in my community to really support the inclusion of youth and young adult voice into our system of care design. And so really come to the work with that kind of framework. We realized that that framework was meeting the needs of some of our young adult population, not necessarily the full needs of our young adults that were transitioning. So worked in the state of Maine. Doing that implementation, we did receive a 2009 Healthy Transition Initiative, and I was the interim state program director for that for a short period of time. Helped support that implementation, but at the national level was also serving as a Youth Move national board member. And shortly after that, in 2014, stepped in as the director of technical assistance and evaluation at Youth Move National once they became their own independent nonprofit. That's when my partnership with Gwen and other technical assistance providers and researchers within the field really looked at advancing the work nationally through a lot of technical assistance support with some strong focuses on youth engagement as well as peer support and other policy related considerations. As I think of my journey and my stories of how I got into the work, I really came to the work from the system of care perspective. We were working on a system of care grant up until the age of 21, really focusing on bringing trauma-informed practices, really mastering what does youth-guided look like and family-driven, but also acknowledging that there were two very separate systems. There was a cliff in our state at 18 or 21, depending of the level of advocacy you had, you were able to stay in the child serving system. And then it was a pretty deep cliff going into that adult system. We also were really focused on evidence-based practices here in Maine. So really looking at trauma-informed interventions, as well as wraparound and other traditional system of care practices. And so as we moved forward through the work, we realized that there was really a continuum of youth engagement. We started from them guiding the process, being really active in their personal journey, and then looking at really wanting to drive, really wanting to be in that front seat and really designing systems as well as making sure that the services they received met their needs and were appealing. We also recognized that as young people were aging and gaining skills and a voice, that the family role was also slight defined, that kind of shift of kind of that fluidity of stepping back and letting the young person really step forward. We created new partners and trying to create some seamless transitions. And there wasn't as many evidence-based practices for this age group, but really exploring evidence-informed interventions that really could create the right appealing structure to meet the needs of young people.
So the right side here is the visual of the evolution among the funders, administrators, providers, and recipients of service. And back then, and maybe today for some of you, it wasn't an easy journey. As a project director and TA provider, I found it very easy to slip back to the system of care, youth-guided and family-driven, were sort of my comfort zone. And I knew very, very little about the adult system, its evolution, and adult partners. So we have some thought work for you here. And maybe you're all very much involved in appropriate services and supports. But we'd like to have a poll here of where you are in your current system and your work with young adults.
We'll give you a little time to review the two questions and select an option that feels most appropriate for you in your current work or within your community setting.
And I think we were just doing question one right now, correct?
Mm-hmm. Yep.
Okay.
I don't know, Dee, if you're seeing that folks are voting and it's looking like the voting's coming to an end, or if folks need a little more time.
Yes. I didn't realize like these were two separate polls, so they did
Nope,
launch at the same time.
Okay,
not a problem.
not a problem. We
We
can
are
talk
nimble.
about both.
All right. Okay, for the first question, it seems like about 51% of you are already kind of advancing the work and implementing age-appropriate supports. We have a small percentage that really haven't thought about it. So hopefully this webinar will inspire you to bring back some good food for thought back to your community. And others are in exploration.
Bree, I'm thinking that back when we started the work, there would have been much higher percentage in the haven't thought about it.
Absolutely.
15, 20 years ago.
Absolutely agree. I think there wasn't much of a framework. There was a lot of good conversation happening, but not necessarily the formal pathways in place.
Yeah.
Okay. It is not letting me advance. Oh, there it goes. Okay.
Oh, yay. Um, so the PYT grant, Partnership in Youth Transition, 2002, that I directed in 2002 was awarded to a county entity to change young adult practices in that county. Many things we learned about practice approaches to make them more age appropriate and appealing. However, there was no required young adult position. There was no direction around different engagement with families and families of choice. Partnership with the adult system wasn't built into that, nor was state or federal policy change. And so it was hard for those grants to sustain their local work. There was beginning recognition of practice change, which you will see in the green bubble there. The child adolescent branch at SAMHSA under Diane Sonheimer's direction responded to these deficits with their next round of funding. And expanded on the lessons learned, very much to their credit. And the 2009 HTI grants could only be awarded to states, tribes, and territories with an emphasis on sustainability, paid young adult roles, state policy change, a different understanding of family caretaker role, and partnerships with multiple age appropriate agencies.
So here in Maine, as I mentioned, our system of care grant was coming to an end in 2009, and we had built such a strong youth component to our program that our young people were really concerned in regards to what happens, and really looking at what happens to not only the systems that we started, but what happens when they're trying to make that formal transition, and really identified some of the big challenges we had. We had really strong partners within our evaluation team. We really created a message to our community on why specializing services and looking at this particular age group would really benefit the state of Maine. So we were able to look at claims data, looking at diagnostic codes, looking at reasons on why we wanted to continue the work in the field. And our young adults actually co-authored our first HTI grant. They were able to envision a system that would work for them, from an intervention to engagement to youth peer support, and also to youth and young adult advocacy. They really looked at the adult consumer movement, they looked at the family movement and said, we need something like this for us, and really gave us an opportunity. And so through that work, we were able to really enhance the system in ways where we didn't have a lot of life skills oriented supports for young people, and we're able to build that into our program as well as advance across. And so we were lucky enough that we were able to get some of the resources from the department and SAMHSA to then kind of help our young people see their vision through.
So a big leap and pivot point was this recognition that funding opportunities reflected that policy informs practice and practice informs policy. And that really became a driving point for me as a TA provider and in the field. The other thing were the formal or informal agreements necessary between the child and adult serving systems, which we now know are sort of non-negotiable, along with those including of other system partners.
So when we look at the policy work focused on our grant, we did bring in new interventions, such as the transition to independent process as a model One of our reasons for doing that is we did have high fidelity wraparound, but older young adults wanted a different approach. Oftentimes they felt that the wraparound didn't necessarily meet their needs in that really true team-based structure. They wanted to co-create their team. We were able to expand upon our youth peer support services. And so the cliffs that we saw weren't just within the mental health system. We started seeing some cliffs within the housing system. We started seeing gaps within that continuity of care. And that was really across the practitioners. Our child systems partners that delivered services in the child system really understood the child system, but really had an unknown in the adult world, and really needing to think about how we cross-trained, how we helped practitioners in the child system really have enough information to really support some solid informed consent as folks were selecting parts of the system in which they may be transitioning to. In my current role, I'm the mental health division manager at Office of Behavioral Health, and we oversee child and adult services. I primarily oversee adult services and some transition age programming. And one of the big things for us, when we started our HT grant, we were two separate entities. Now we're one entity under one roof. When we at first started, housing was a huge challenge. There wasn't really age appropriate transitional support services for young people to move into. In my new role, I'm really excited that we were able to really create housing opportunities that were really developmentally appropriate for young people. So young people aging out of foster care, turning 18, that might not be able to step in or stay at their family home, really was able to move into really appropriate settings for them to continue learning, growing, and advancing in their goals. And that wasn't always the case. It took us a lot of work in those partnerships from the cross agency perspective to understand that just because you're 18, it doesn't mean the service is appropriate, and that we still needed to continue doing some work. But we were able to eventually get there here in Maine with time. And so very excited about some of those policy shifts for us.
Bree, one of the things that occurs to me is that thing of age appropriate and appealing.
Yes.
And that you can speak of that young adults weren't finding the services in the adult system to be either of those things.
Yeah, and I think that's a really important part because I think young people at that point were experiencing a different type of young adult advocacy that was very different than our adult consumers. And so when you think of housing in particular, every young person wants independence, they want their own apartment, but going into an adult group milieu residential care facility where you might have a larger age gap, that was really a turnoff for young people, and they prefer couch surfing or other not so positive alternatives for them. And so I think that was one of the big reasons why we really needed to think of a group milieu setting that really built off life skills, employment, and mental health support and recovery, but also allowing them to step into supported apartment models, which is exactly what we did here in Maine.
So here we have these three key policy questions that we think are a good place to start thinking about your work arena as the field moved from practice to policy, and then policy and practice together being critical. So I'm going to give you just a minute to read these and think about your setting. And then this can be a part of our discussion when we get to the discussion part.
Okay. We've given you a little bit of time to reflect on those key policy questions. And as Gwen mentioned, we can bring that back into the discussion at the end, but we'll move on to the next, which really is the reflection for young adult involvement. This was honestly one of my professional it was my most professional kind of satisfaction in the job, is to really see the growth and development from youth guided practices to youth driven practices. As I mentioned before, there was the advocacy movement of deinstitutionalizing in the adult world in the 90s. We started seeing stronger family advocacy movements happening. And it really wasn't until the early 2000s that this idea of young people could be at the table as well, driving practice. It quickly shifted when the branch and SAMHSA and other funding entities were really requiring hiring a person with lived experience. And that role really evolved over time. It really started to kind of running a youth group that was serving in an advisory capacity to really advancing into a true professional career pathway. And so over the years, and I think really the healthy transition and that young adult movement really kind of said, we can do more. We have the expertise to contribute to systems design. We can advise you on what works and what doesn't work in ways that will be meaningful for practitioners, meaningful for communities, and meaningful for those utilizing services. And so I think it's really important that we had a lovely opportunity to learn from different generations on how would we organize the work. We did have a National Youth Leadership Board that started in those early 2000s that advised SAMHSA. That youth board turned into kind of what we know today as Youth Move National, which again was a organization that really motivated others through voices. That's how they came up with their name, of really organizing and creating pathways for folks to contribute in really meaningful ways. One of the things that came out of some of that early work that we did was really this kind of, what do you do? Gwen touched upon it, Marianne touched upon it. Clearly now, as a mental health division manager, I'm not a young person anymore, but how do you utilize your lived experience to advise the system and continue to create a pathway? Documents were created that really helped individuals own their own personal story, help them really do strategic sharing and how to fold that in to their community work. We turned that into advocacy opportunities, and we were seen as resources for change within the work. And at every time, everyone got a little worried, like, gosh, I'm 22, I'm 24, I'm 25. Now what? Am I going to lose my job because I'm not young enough for the work? That we had to really think about that fork in the road of what do we do? We believe in this work. We see the value that it can bring to the field. And then you end up utilizing that experience really in a professional manner. Some folks that were doing this work early on with us went on for advanced degrees and became clinicians or continued working in the advocacy and the policy world. But really, how does that shape so that you're creating an opportunity for that next generation to also step in? We all had to stay true to who we were as we were working with young people in the community, that these opportunities are easily to get kind of co-opted to do certain things, but really staying true to us and who we were as advocates at this time, and really supporting and maintaining that youth-driven perspective. And oftentimes that came with challenges, and it came with a lot of opportunity to capitalize off. We also recognized as we were aging, and maybe we were leaving the field or doing something slightly different, but our personal experience never leaves. And I think as we navigate through that continuum, your own personal journey shifts. I know personally for myself, I often say that I wasn't able to really do the good work that I needed to do with young people unless I was truthful with myself and honest, and found pathways to go back and seek my own support for my own traumas and things that I was experiencing, and then utilizing that to then find ways to help support young people understanding their trauma as well. And then there's a time where you become an advocate on behalf of young people. You are not the young person necessarily. And then you step into roles like I'm in today as a supportive adult. I strongly am always at the table, always asking the question, where are our young people? Have we asked young people? Really making sure that they're a part of the design, and they continue to be a part of the work today. It's a journey. Um, you'll see a variety of youth involvement work. And when we say youth involvement, it really can be as advanced as expertise and consultation that they can provide. These are paid roles. These are true professional pathways. And so your program might be starting really small by gathering voice through advisory structures or surveys, or asking them what they thought about services, but you can really advance this. And here in Maine, and nationally, just like we have Youth Move National, we had a Youth Move Maine chapter. We are able to continue to put supports for procurement to create opportunities for these activities to continue as a standalone entity, which is very, very impactful in that sustainability. It's not a social activity. It really becomes a necessary component of your system. I don't know, Gwen, if you have other thoughts to add.
Oh, I have, but could you talk a little more, Bree, because I think it's about that continuum of peer support opportunities. I remember very clearly a young adult saying to me, I don't want a paid friend.
Yes.
And then Youth Move National helping me with, well, there's this whole continuum. Can you talk a little more about that?
Yeah. And so when you think of youth engagement, there's publications on Youth Move's page. So I encourage you all to go look at their resources as well. That really talks a lot about what we learned over the course of time. Work was really informal. It really was young people coming together on a similar idea. Sometimes that was thinking of change, thinking of their own personal change, the system's change. And as we continued to refine what coming together looked like, we started to formalize that work. And so formalizing that work in my community, we would meet twice a month. We'd have a pretty large group. And one day we'd really focus on personal journey. Like, what does it look like internally to create change in your own life? But then we would focus time on what does it look like to create change within our community, within our state and or national. And I think at the same time as Youth Move National was evolving and growing, they were having those same reflection opportunities as well. As we shifted, you have formal peer support, which in many communities was a billable activity on the adult side and on some of the family side. And then there was opportunities where maybe it wasn't billable, but the community did need to see its value, needed to think about how you would create these formal pathways where you could be advising the system, or you could be delivering services within the system as a peer support worker, which gets to a little bit more of the formal service opportunities. And so when you think of that continuum, you're really thinking about guiding practice, being a participant and advocate of change, becoming a provider by supporting the delivery of service. And that could be through those peer support opportunities, but really thinking about how do you build that infrastructure for all of those activities to continue and be sustained over time. Some of them may not be billable, so they have to be supported through your state infrastructure, while others might fall within a Medicaid billable treatment or service. It was the same thing with adding youth and young adult advocates to high fidelity wraparound teams and engaging them within that treatment. And so no matter where you start on the continuum, there's always opportunities to advance it to that next level. And so I wouldn't get discouraged for those of you that haven't quite thought about where your community was with this just yet. Starting somewhere is the most critical part of recognizing that the only way to develop an age appropriate and appealing service is to talk to the individuals using it, checking in with them frequently, and then helping them create a vision for both the formal and the informal supports that they might need to help them with that transition.
Thank you, Bree. And I see Dee in the chat has put the link to Youth Move National, and I highly recommend the materials they have there. And I really, Bree talked about two of them, the continuum of peer supports and that transition from youth advocate to advocate for youth. All of these things were supported were a huge pivot point for the child, adolescent, and family branch. Diane and the professionals there were very nimble in funding to support the lessons learned from the field, from evaluation, from research, from recipients of service, and the advocate community. For myself, as project director for PYT in 2002, it was optional to have a youth coordinator. And we hired a recent MSW graduate with no lived experience in the field and had a youth council. Then SAMHSA moved in its funding journey to HTI, where you needed a paid position filled by a young adult with lived experience. That you notice both Bree and I came to use the term lived expertise because I think that's a better term in my mind. It's not just experience, it's expertise. For then now is the time transition grants, there was a required sustainability plan for paid young adult positions and a strong focus on what Bree's been talking about, the youth and the peer support continuum. And it does all take funding, and maybe areas of inquiry are with limited funding dollars where things go. Our experience was very often, if there wasn't a sustainability plan, it was the young adult positions that went first out the door.
Absolutely. Okay. So we have another poll question here. I'll turn it to you, Gwen.
I think this is one people already answered, Bree, and if we can remember, oh, yay, Dee, thank you. Recipients of service, obviously, that's really critical, and advisory councils and boards. Young adults hired to develop and oversee young adults. What do you think about 3% of that, Bree?
Well, I think there's always room for improvement in all communities when you think of youth and young adult work. And I think that there are reasons why organizations get anxious when they think about a young person. We often hear, like, is the young person in recovery enough? Like, have they done the personal work they need to do to be of value and support in different roles? We hear across consumer movement work that perhaps part of your own personal journey was engagement within the legal system, and the background checks or the agency's requirements and hiring practices may automatically exclude individuals with lived experience. And so there's a lot of hesitation within organizations that feel like quick justifications on why not to do the work. But I want to encourage all of you that there's resources. Communities have done great work to create toolkits for how to hire and employ individuals with lived experience, starting to kind of see that value add. And as I mentioned before, like, there's a strong movement of individuals now my age, kind of mid 40s, that started in this work that have made a true professional career out of this work. And when you think of your youth engagement work, my perspective was, what is my project director doing? I should do as the coordinator of the youth program. So if they're doing a strategic plan, I should try to do a strategic plan. What do I know about the financing, and how can I learn so that we can advocate for funding and sustainability? So there's really a nice opportunity for mentorship with project directors and others to also mentor and support and partner to really help create frameworks that are lasting, that minimize any of that hesitation within your state or agency. And I think coming at it from that perspective you can be very beneficial, but it's doable for sure.
And I would add administrators learning from the young adults or now advocates for youth experience and what has worked in the past, that type of thing.
He is not. Here we go.
Yeah.
Did the same thing. Okay.
So one thing I learned early on in PYT from my research friends is that families have developmental transitions too. I look back at that and think, duh, where that was a pretty obvious thing I had missed. And also, the family members do not age out, as Bria's talked about her colleagues aging out of being a young adult with lived experience. Family members don't age out, and they have to learn to that shift from being in the driver's seat to being a navigational aid, and it's hard. And I also learned that there are a whole group of families who need support, even if their children or child currently is choosing not to have them involved in their lives or their life plans or what they're doing. Both Utah and Maryland parent organizations developed publications, groups, and peer supports for family members, regardless of their current involvement with their children. And I think that's really very critical.
Some of the things that I learned in both the local level and nationally was really the role that family advocacy organizations may or may not play within the youth and young adult work. And so in my community, we had very strong Federation of Families chapters that really saw that their audience included young people, and that was part of their mission and vision, is that they could do the work, they could engage young people, but they represent young people when they speak. And our young people really didn't see it that way. They saw it as you represent the family voice and perhaps the voice of young people that have connection to family. And so they did a lot of educating to me that family needs to be self-defined, that sometimes families were a source of trauma. So there's a lot of distrust within that family dynamic. A lot of young people aging out of foster care didn't see that they fit into that definition of family as our family advocacy organizations were trying to be inclusive. And so we found really great ways to continue to collaborate and partner, but really recognized that young people needed an advocacy organization that met their needs, that really supported all. And so we continued down that pathway. What we saw at the national level is family advocacy organizations across the country, with a lot of our youth move chapters, really served as a infrastructure support. So they really kind of a judiciary at some points, other points, really kind of the home in which young people could convene and come together. Some communities, that's where the family and the youth coordinator was hired, so that they would be able to have a lot of those administrative supports to be as successful in designing and implementing their work, because not everyone was able to be a fully sustained kind of youth advocacy organization right off. That came with a lot of positives, but also came with challenges, because at the end of the day, it was kind of which voice kind of had the oversight and final decisions when you were nestled within an organization. And that really created some ripples for some communities of like, we're the youth organization, this is the decision we'd like to advance, but then there was still this go to the board of this organization for the final determinations. And so that sometimes also played out professionally, the same way that might play out at home with family and young adults disagreeing. And so ultimately, the Federation kind of served as that nurturing entity early on for Youth Move National, but the goal at the end was that they were always going to be an independent organization like they are today. But again, I don't think we could formally have been as successful in that without at least having a home for a short period of time within that administrative support and function that family advocacy orgs often provided early on.
And Bree, I don't know currently what those relationships are between family support and youth advocacy groups. But I think you're right. I love it when you said it was sort of like family transitions versus young adult transitions. The family organizations were very supportive, but then it got a little ugly with who's in charge.
Who's in charge? Those final decisions were
The
definitely we're definitely, you're coming at it from two different perspectives. And you can't have two drivers of any one car. So someone's got to choose to step back and ride shotgun or be the navigational aid. And so it definitely was
That's why I like that visual of the transition from being the driver to being the navigational aid. And to a certain extent, Bree, as now an advocate for youth, you've had to do that too.
Oh, yes. I was at a consumer advocacy conference last year, and I actually saw one of our first in the state of Maine youth peer support workers at that advocacy conference, and now is serving, she's mom, and is now a parent advocate. So, you actually kind of see the value of lived experience and using it professionally. So for my young folks, I see them now, and their supervisor is the family movement, and they're, really able to kind of help lend and offer that different perspective and kind of help bring the organization along. But there's definitely a lot of transitions.
And I think all those listening to us, Bree, do know that funding for those organizations are really at a peril now. And so, even if you're looking for research and evaluation opportunities, what this period of being responsible for your own funding will bring with it.
So this is the cross systems partners. This is crucial for a lot of various reasons, sustainability being one, really getting buy-in, kind of making that cliff feel more seamless and smaller as young people are transitioning. And so when I was in this work here in our community, it was really about thinking about our formal partners and our non-traditional partners. And when we think of non-traditional partners, the big example for me was really thinking about those advocacy organizations. We had an option. There was a decision on the table for us as a organized group of which pathway would we like to go. When we were thinking about peer support, really thinking about, well, the adult system has a really strong infrastructure. They have a strong curriculum. This is one option for us. Our family advocacy organizations also had a curriculum and a pathway for parent to parent kind of support. And so really needing to make some well-informed decisions. And we ended up, we knew a lot because our system of care days gave us a lot of knowledge about what a family advocacy organization did, but we didn't know so much about the adult advocacy movement within the adult system. And so we really spent a lot of time getting to know our adult advocate partners. What is the infrastructure? How is it funded? What are the curriculums that you have? And would they make sense for our young people to also fold into that work? Our state had a really strong state operated infrastructure for certification and training for adult peers, day programs where folks could walk in and participate in recovery work that made sense to them. And so we started partnering with the state leaders to introduce us into the types of young adult programs that young adults could step into. And then we realized early on that how those systems were designed were not appealing for young people, or they didn't quite make enough sense. And so one of the things that we did was we reviewed all of the requirements for full certification for intentional peer support. It started with an application, and then you participate in 40 hours worth of training. And just from the application, the words and the questions asked of adult consumers did not make sense to young people. So it asked questions about how long have you been in recovery? And young people didn't see themselves necessarily in recovery. They saw that this was a part of them, but they've been able to navigate and manage. So they didn't have this like put a number on a piece of paper. They really saw it as very fluid. They saw that they were able to contribute in ways that would still be meaningful, but they didn't want to necessarily quantify it to a number of years that they might have been. So we were able to work with modifying that application to create questions. It really created opportunities for young people to talk more about their personal journeys and their experience and why stepping into a peer support role might be most valuable for them. Well, and we sent young people to the full certification with adults in the room. So we went and we did pre and post check-ins every day of the training with the state curriculum team and leadership team. Young people were able to fully participate in the training, but also give feedback of like the examples you used in the training. These terms didn't make sense, or all the examples don't make sense for young people today. Like we need examples about school. We need examples about stepping into employment. And so we were able to co-create new materials for that certification process that allowed young people to be full participants in it. But they were still able to create opportunities where the younger generation could learn from the older generation, and the older generation could also help support the younger generation, understanding how we've all come to be in the work that we're currently doing. And so we really partnered in at a local level with those non-traditional partnerships in our consumer work at the national level. We also saw the same thing happening. Wellness action recovery planning was a very strong evidence-based models in the field for adult consumers. And we started seeing the shift about how could that be tailored specifically for a young adult population and or start as a child population and move in. And so there was also other aspects within the adult movement that I think we created opportunities for more young people to get involved in that work, which created a new awareness of a different age group and a different type of experience for folks coming into the advocacy field based on the current state.
And in terms of non-traditional partnerships, I'm going to add healthcare transitions here. And I did some work with GOT Transitions on the National Healthcare Transition Center. I think that's a big open area for inquiry. And it also has that issue of what's the family role and when is the family a big support and when do you not? And that move from pediatrician to primary care provider. We also, Bree has mentioned and Angela put in the chat, housing. That's a big one. And a big lesson learned for me was the cultural differences between systems can be a huge barrier. And as somebody who came into the work only knowing the child system, it was like a lot to think about. Take the issue of young adult driven services. That's a difficult factor in the justice system. And it takes a very different form in education and in drug and alcohol, especially when that hits up against the justice system. So does the role of families, which I just indicated, especially in the adult mental health system, where there's a long history of some real negativity with family involvement. I know a young adult in Allegheny County who made an appointment with their OVR counselor and marched right in and said, I am insisting my parents be a part of this. Because the culture in OVR is you don't bring in the families. But Jeff was able to be his own advocate and say, these are the people who are going to drive me to work. I need these people to be a part of this setting, but he's a very strong advocate for ourselves, and we have to work with systems to have that work together on very individualized approaches. in Allegheny County, we had a outside facilitator facilitate a meeting with the young adult system partners to identify common values, acknowledge where institutional requirements and legal mandates were different, and how best to work together. And I highly recommend that. And again, that's an area of inquiry where all these things bump up against each other. In two education school districts in Allegheny County, we piloted using one plan, a combined IEP, mental health plan, and OVR plan, patterned after work done again in the early 2000s in Minnesota. But again, that all involves understanding each other's legal requirements and the culture of the people on the ground doing the work.
When you bring up a really good point as you're talking about that vocational rehab young person that was
Yeah,
advocating, is one of the things I experienced was some of the young people in our group that their families had supported them early in their journey and they were on Social Security already.
yeah, yeah,
And that was a big component because they saw themselves as not able to work, that they shouldn't work because they may lose benefits. And so we also had to do a lot of education, both to the family and to the young person, that there are pathways to continue to work without necessarily losing benefit, and really working with the adult system to help the family make that decision.
yeah,
And for those that maybe weren't able to truly work, still creating meaning through volunteer opportunities in other ways that they would be able to contribute and gain skill, or participate in supportive employment as well. But that also is a big cross system as well as
yes,
cross child and parent kind of conversation, because there was a lot of potential fear, if I started working or gained skill and employment, that I would lose out on the things that I need to support my healthcare. Okay.
Um, Sorry to interrupt. There was a question about the acronym OVR. Is that the Office of Vocational Rehabilitation in Pennsylvania, or is that
yes,
something else?
yes. And thank you for bringing up that, Dee, and whoever brought up the question, because last night I actually said to Bree, is it still called OVR? And our only experience was Maine and Pennsylvania. So whatever the employment, I think the people listening to us, Bree, have a much better grasp on that. But thank you.
All right. So the next pillar for success is really leadership sets culture. This is another one that has just kind of stayed with me over the years. When I really think of what is necessary to really make this work meaningful. And it really does come down to the leadership within your program, within your agency, and really thinking about how they can set a tone and set individuals up for success, or challenges. And so, really looking at who those leaders are, formal or informal, within your community to really help kind of set the bar and create the pathway to move forward, that can really promote the work you're looking to do. I think in this, I always think of Gwen. So this is a catchphrase that I got from Gwen, through all of our time together in consulting. And so when, I look at my local level and I think of who were the leaders that helped get our youth component up and off the ground. But then when I really thought of leaders that helped advance the movement nationally, it really is, Gwen was a true champion, really understanding the value of youth and family, always bringing that back, always creating opportunities to see this more than just youth at the table advising, but really youth with expertise. And how do you build that expertise into all of the work that you're doing at a local level, which was crucial. And that's what we were asking of communities to do. But Gwen was able to take that and nurture that at the federal level. really be able to show that if we're going to do this, we need to model it and we need to do it right. And we need to partner effectively to create those opportunities so that when communities could see the federal partners really buying in, it really made a lot of sense for those state partners to buy in if those state partners were naysayers early on. And so I think a lot of this work, a lot of the materials that we developed, Gwen was with us developing at Youth Move National, really helping us think through this journey, and really was a catalyst at the national level to really make sure that young people were participating in equally important roles as Gwen had as a technical assistance provider within the field. And Gwen, I don't know if you want to share a couple
Yeah.
of those strong advocacy moments you had for us with our federal partners.
Well, thank you, Bree. When I first came to Georgetown and HTI, my responsibility was a site visit to each of the HTI sites annually. And in 2010, 2000, beginning of 2011, I did a couple. And then I came back and said to Diane at the branch and Jim Watron at Georgetown, technical assistance to communities serving young adults is not one old white lady named White. I can't do this, and it's not right. And they were very good about finding the funding and agreeing to include a young adult and a family member with lived expertise, including Indigenous consultants when appropriate, on all site visits. And I do think that that became the norm for national technical assistance. And I think there's parallels in leadership along those lines in research and training. And Amanda and Mary Ann and Nancy will be telling you about that. But it is a pivotal point. And also in terms of leadership sets culture, many states, tribes, and territories have administrators who are also advocates that work and continue to work in state settings that are not always friendly to human services. And they've done incredible things. Massachusetts, shout out to Massachusetts, and the fact that their young adults are now able to pick and choose, mix and match their services between the child system and the adult system and say, this is what I need from here. It's very important. That's when we get down to courting champions. It's the champions that make those things happen in the really difficult times, especially that we find ourselves in now. So identify, be thinking in your head right now, who are your current champions? Identify them early and always, and remember that trust and relationship building is really critical to keeping this work going.
Which moves us into our next pillar of success, which is really the community and connection and the importance of networking for all. And as Gwen mentioned, utilizing young adults to go out on federal grantee monitoring visits and the technical assistance. That's also the same time where Youth Move National was really a strong partner with those technical assistance entities and providing a lot of resource and supports, especially for those youth coordinators who might have felt somewhat isolated in their community, creating that national connection. The importance of, coming together with like-minded people that are in similar roles as you, learning from one another, knowing that if you had a hard day, you had a friend in another state you could reach out to, you could learn from states that were further along in the work. And when you have those connections, and I'm speaking from the youth and young adult perspective because that's the technical assistance I did for so long, but in my role now as a director, I lean in on my other community directors to learn how things are operating within their state. And that sense of belonging when you're connected with others, like-minded positions, dealing with similar challenges that you may be dealing with, there's a lot of opportunity there to feel reinvested in the work or to hear a solution that you hadn't tried yet. And so really just creating those opportunities. And I think the value of technical assistance across many centers that's available is really creating those opportunities to learn from others, to steal shamelessly, to participate in learning collaboratives or communities of practice, really getting that facilitated coaching and technical assistance so that it doesn't always feel daunting. And thinking of ways within your own community. If you're a county based, maybe there's another county that is a little further along than where your county is. And how can you collaborate so that you're not starting from a blank slate? You're starting from a slate full of potential ideas and you're learning from lessons learned across. And I think that just brings a lot of value add. And it also allows you to connect the data or good concrete examples to bring back to show that it is possible in your community. If you don't quite have the champion or the buy-in just yet, you're really kind of building that justification. And so cannot stress enough of tapping in to community, both locally and or your national kind of technical assistance partners that can be of assistance. Move on to the next one.
We're moving on to the next one. So this is very similar to community. I'm in Pittsburgh and I knew Fred Rogers, and you will recognize this as his statement. Bree and I thought this was very important in our world right now, that find the helpers that make up your community, formal, informal, colleagues or mentors, those designated by the system, a GPO, if they're around anymore. But within the community, there are the helpers, and just sort of find those helpers. Something I learned from my evaluation and research colleagues, an important data point, critical to policy and practice. Individuals' perception of hope and opportunity is very critical. And individuals, we at least found in Allegheny County, with complex trauma still had hope in adolescence and young adulthood. And that hope was a predictor of success in transitioning to adulthood. You don't find that perception of hope, my understanding. Thank you, Catherine, GPO grant program officer, or others who are your responsible funders. You don't find that perception of hope as often as older adults in the system. And I'm saying that's something about the system. But for you all, that perception of hope, I think, is very critical at this point. Thoughts, Bree?
So I'm feeling this one more now as a mental health division manager.
Yeah.
And so it's always a reminder for myself, because when things feel so uncertain and you may have funding cliffs that are not timely, or things that you felt we were moving, but you had a change in your state leadership or your agency leadership, oftentimes you don't always kind of feel hopeful in that decision. And kind of, again, coming back to where are the components in which we have tried to work through our relationships to help sustain the value add of the work? Where are we with policy changes that will help sustain at our local levels? I've really had to lean in on recently, and really thinking of, I'm really glad that we put that in policy and that we created an opportunity to create a waiver, to create a smooth transition, that I wasn't necessarily dependent on an external source for that. That I know where I need to go to look for my helpers when I'm getting on a grant team meeting and we all just got horrible news about a grant coming to an end, and really finding space to think about the state doesn't feel as hopeful, but I'm a firm believer that the pendulum swings, and that, you might need plan A, plan B. But when you're surrounded by the right people collectively, you can motivate and inspire for that future hope and opportunity if it's feeling a little rough. I think I was sharing with Gwen, I always have plan A, plan B, and now I'm feeling like I need plan A, B, and C. And so that list is getting a little longer, but I'm not going to give up. There's other ways to continue to do the work. And again, it's rallying and pulling those champions and bringing the value of the work to the forefront again, so that you can continue sustaining that work moving forward. Okay.
Mhm. So we've only touched the tip of the partnership between funder evaluation, research, and technical assistance. And I realize we should have also on there those in the field doing the work. Those of you who are actually doing the work and have so much valuable information on what is working and what is needed. These relationships and working together are critical and have moved in the last 30 years, very much moved the field ahead in a positive direction. The next webinar delves into evaluation and research. Stay tuned. Amanda and Marianne and Nancy have a lot to tell you. But please know that a part of everything Bree and I have talked about today weaves in those very valuable partnerships. So we end with this picture from 2023 when Bree drove 3 hours to northern Maine to have breakfast with me in the woods. And we included not because we're so darn cute, but we are, but because we see it as an example of 30 years of partnership that have changed lives and 15 years of partnerships for us. I moved from considering Bree a young adult with helpful information to someone with impactful lived experience I should maybe listen to a subject matter expert, not just with her lived expertise, but in many, many other areas, to a colleague and a mentor, a collaborator, and a friend. The work she does now is incredible and important, as it is to the work you all are listening to today. I'm awed by her professional competencies and the impact she has on changing lives through policy and practice.
Thank you, Gwen.
And we're turning it over to Liz.
Yes.
Thank you both. That was an amazing presentation. And good afternoon, everyone. For those of you who I haven't had the pleasure of meeting yet, my name is Liz Thomas, and I'm an assistant professor in the College of Public Health at Temple University. Over the past 2 years, I've had the tremendous pleasure of co-directing the Community Inclusion and Reflective Collaboration Center, or CIRC Center, alongside Dr. Catherine Sabella, and in collaboration with other members of the Transitions to Adulthood Center. CIRC is co-funded by NIDLR and SAMHSA, and our mission is to advance community participation among young adults with serious mental health conditions, especially those with the greatest support needs. And as a mental health services researcher and someone who's deeply committed to supporting young adults, it truly is an honor to serve as today's discussant. Again, I want to begin by thanking the presenters, Gwen and Bree, for offering such a powerful reflection on 3 decades of policy and practice focused on youth and young adults with serious mental health conditions. What we've seen today is not just a chronology of programs and initiatives, but it's really a story of persistence, of cultural change, and the long arc of systems transformation. And what's clear from this history, as I hope you all have seen today, is that we've made meaningful progress. from early, more fragmented efforts to more intentional, developmentally responsive systems of care for young people between 16 and 25. But as we reflect on where we've been, we also need to ask, where do we go from here? So in my remarks, I'm going to reflect on three areas: the evolution of policy and the gaps that remain, implementation of services and the need for sustainable system transformation, and the growing leadership of young adults in shaping the future and the work still ahead. I'm also going to share a few thoughts on the broader challenges that we're facing currently in sustaining this work, particularly in the current climate, and offer some questions to guide our continued dialogue. So I'll begin with a few reflections on policy. The presentation traces an impressive lineage of federal and state efforts, from the Partnerships for Youth Transition in 2002 to multiple waves of the Healthy Transitions Initiative. And today we're also seeing the rise of coordinated specialty care, or CSC, for young adults with early psychosis, supported in part by congressional allocation of Community Mental Health Services block grant funds for early intervention initiatives. These investments were spurred by recognition, thanks in part to the seminal Davis and Vanderstoot paper, that young people aging out of child systems were falling through the cracks. What's especially noteworthy is how these efforts have redefined the 16 to 25-year age group, not as a gray area between child and adult services, but as a population with distinct developmental, social, and mental health needs that require tailored supports. And yet we must ask, are we there yet? Is this age group consistently recognized across systems as requiring developmentally appropriate care? Unfortunately, in many communities, the transition still remains fragmented. The handshake between child and adult systems, posed so aptly in the presentation, is often missing or perfunctory. And even when that connection exists, we must ask, are adult services truly prepared, both culturally and practically, to engage and support young people in meaningful ways? We must also acknowledge the policy and funding challenges that continue to limit access to care, such as changes in eligibility status as young people move from child to adult systems. And addressing these structural barriers is as important as designing the right programs. Next, a few reflections on practice. The presentation also prompts us to consider how the culture of service delivery has changed, slowly, unevenly, but meaningfully. Over the past few decades, we've seen a move towards incorporating more youth-driven programming, a greater emphasis on peer support, and more robust family and caretaker engagement. But there is the reality of implementation. The polling questions embedded in the presentation surface what many of us know from experience, that communities are in very different stages. Some systems are still in the very early exploration phase, just beginning to consider what age-tailored supports might look like. Others are actively implementing promising practices, but often with limited reach or short-term funding. And many face real challenges when it comes to scaling and sustaining change. This underscores the need for ongoing technical assistance, research, and infrastructure support. We can't expect transformation to scale without equipping local systems to do the work. Finally, I want to reiterate the importance of cross-system, non-traditional partnerships. Young people don't experience life in silos, and neither should our systems. The integration of education, housing, workforce development, and justice systems is essential for long-term success. This kind of cross-sector collaboration is still emerging, and we know it's not easy. When recognize this, systems come with their own languages, rules, and cultures. But for young adults, these systems intersect every day. If we're serious about building sustainable pathways for recovery and community inclusion, we must invest not only in programs, but in the relationships and governance structures that allow cross-system partnerships to thrive. One of the most encouraging developments, for me at least, over the past 30 years has been the rise of young adults as leaders, not just as service recipients, but as program developers, peer specialists, researchers, and change agents. As the presentation highlights, this shift reflects a deeper cultural transformation from doing for young adults to doing with them. At the Cirque Center, we've seen firsthand how powerful and transformative this can be. Some of our most meaningful and rewarding work has come from partnering directly with young adults in the design, implementation, and dissemination of research and knowledge translation efforts. For example, in a recent study exploring community participation in the aftermath of the COVID-19 pandemic, we created opportunities for young adults to serve as co-investigators, interviewers, and data analysts. Their insights are helping shape interventions, services, and policies in ways that are deeply grounded in lived experience. This approach doesn't just elevate youth voice, it positions young adults as experts and ensures that the solutions we pursue are informed by those who know the landscape best. That said, we must also acknowledge the challenges that come with sustaining young adult leadership. For example, are we fairly compensating and adequately supporting young adults in these roles? Are our systems flexible and responsive enough to accommodate the evolving needs young people have who may be still navigating school, work, relationships, and their own recovery journeys? And critically, are we paying attention to equity, ensuring that those who have the greatest support needs have a seat at the table? True youth-driven systems require more than good intentions. They demand structural commitments to shared power, mentorship, and long-term support. The issues raised in today's presentation feel especially urgent given the challenges we're currently facing. For example, funding for young adult mental health remains vulnerable to shifting policy priorities, budget constraints, and broader ideological tensions. At the same time, young people are navigating an unprecedented combination of economic pressures, social isolation, and increased uncertainty about their future in areas like education and employment, all of which can significantly impact mental health and well-being. So as we look ahead, I'll leave us with a few questions to guide our continued efforts. And we can go to the next slide. What structures, fiscal, organizational, relational, will help us move from promising pilots to truly transformed, sustainable systems, especially given today's complex environment? How do we embed youth leadership, not as an optional enhancement, but as a foundational element of system design and evaluation? And how do we ensure equity is not just a lens we apply, but a foundation we build from at every stage of the work? The past 30 years have laid the essential groundwork. The next 30 should be about institutionalizing what we've learned, scaling what works, and continuing to advocate with young people, even amid uncertainty. Thank you for listening to my comments. And now I'm going to turn things over for the Q&A portion of the webinar. So please feel free to write any questions in the chat or use the Q&A feature, and we will get started with Q&A. I'm taking a look at the chat right now to see if I missed anything while I was talking. Some compliments to Gwen and Bree in the chat. Wonderful presentation. I'm not seeing anything yet. I'll still keep an eye on things, but if it's okay, maybe I'll kick us off with a question for Gwen and Bree. Based on the successes of the past 30 years, what gives you all the most hope about the next generation of mental health system reform for young people?
Do I get to go? You go ahead, Bree.
I can when I reflect back on my personal lived experience, mental health was always a shameful, not well talked about in community.
Mm.
So it was very much something you handled internally with family. Occasionally, you might have had external supports. And so I do think over the last 30 years, we have done such a great job with trying to reduce stigma. There's more work, there will always be work, but I do personally feel like it's a topic that is discussed. There's not as much stigma associated with it, which allows young people to be a little more vulnerable, but to step forward and ask for support that I felt just wasn't there early on. And I think that is one step moving forward, that the more we can talk about it, the more that we can acknowledge that it is okay, and that there are pathways for recovery and opportunities, that a diagnosis doesn't hinder you long term. It's just a part of who you are, and you can still achieve all of the goals you may have outlined, with the right supports around you and the right plan in place, which I think we've done a lot of work around that, which I think is very hopeful.
And Bree, that reminds me, we forgot to mention the whole social marketing aspect of SAMHSA's granting. Grant
Absolutely.
funding that did a lot around stigma and that. And my answer to you, Liz, is certainly that move for recipients of service, from recipient to service to professionals in the field. That's for me the most hopeful thing. And I liked your framing, Val, however, of how do we institutionalize these things and find proper funding for it, which is always a question.
Certainly an ongoing challenge, but so important.
Mhm.
Thank you both for your reflections. I agree that we've come a long way in terms of stigma and really acknowledging that mental health is a human experience and that it's okay to seek help. And that is something that can give us hope for the future. Well, I'm not seeing additional questions in the chat, and we do have just a couple of minutes left. So I think at this point, I'm going to turn it over to Dee Logan to close out our webinar.
Yes, I just want to again thank Bree and Gwen for their wonderful presentation, and their reflections on the work that they've been a part of. And Liz, thank you so much for your reflections on the webinar. Yes, I just have a few last minute things that remind you about. As you know, our next webinar will be on June 2nd. That'll be part 2. And if you haven't registered, please feel free to do so. The CERC Center has some great resources and dissemination pieces that they have made over the past year or so. And so please go check out their section on the Transitions to Adulthood Center for Research for more. We have podcasts, we have short videos, we have tip sheets, and their previous webinar that describes the center and its work in more detail. And then finally, in case folks are interested, the iSpark, the Implementation Science and Practice Advances Research Center, is hosting our annual Massachusetts Department of Mental Health Research Centers of Excellence Conference. That is on May 29th. And please feel free, if you're interested, to register for our conference. And I just, again, want to thank everyone so much for your joining us this week, and hope to see you on June 2nd.
Thank you.